Hello everyone, this is Tanya Burkhardt. Today I'll be giving you a presentation on the prevalence of asthma in adolescents in New Jersey. The first thing we're going to cover today is assessment. Asthma is a serious health issue that affects a large number of adolescents in New Jersey. In 2008, the CDC estimated that 19,701 10 to 14-year-olds and 15,342 15 to 17-year-olds were currently living with asthma. Even though both numbers are high, asthma is more dominant in boys than girls and can be seen by the pie graph as most common in Black ethnicity. Identification of health issues and problems are most notably breathing and respiratory difficulties. Adolescents have been affected by this disease in the following ways: more frequently absent from school, limited participation in physical activity, criticism from peers, low self-esteem and social stability, and are 3 times more likely to have behavioral problems. Now we're going to look at the risk factors and demographic information. The major risk factors of adolescent asthma are environmental, genetics, and hosts. Examples of environmental triggers are dust, pollen, mold, weather changes, and air pollution. For genetic, 18 regions and more than 100 genes are associated with asthma, consistently replicated on the long arms of chromosomes 2, 5, 6, 12, and 13. Other genetic contributing factors are tobacco use during pregnancy, poor nutrition during pregnancy, maternal stress during pregnancy, and antibiotic use and infections during pregnancy. Thirdly, examples of host factors include nutritional allergies, decreased airway caliber in infancy, poor hygiene, and antibiotic allergy and infections. Other demographic information that ameliorates the risk factors of adolescents' asthma are poor education on the disease and improper medication use. According to a survey done in New Jersey by the National Heart, Lung, and Blood Institute, approximately patients did not know where their peak flow meter to adjust daily medications. 68% of patients were not given an asthma action plan, and 92% of patients had never taken on a course to manage asthma. Now we're going to move on to the essential services. The 2 essential services that revolve around assessment are applied to asthma in adolescents by first monitoring health and secondly diagnosing and investigating. Health is monitored by obtaining clinical control with identifying the underlying issues and determining the best treatment possible. Reducing future risk can be accomplished by monitoring lung function and bronchial receptiveness. Adolescent asthma can be diagnosed and investigated through using a medical history, physical exam, and spirometry. Investigating a medical history will give insight on any family history, signs, symptoms, and risk factors of the illness. Physical exam helps to identify signs of symptoms and indicate areas of concern. And thirdly, the use of spirometry can aid in the diagnosis of asthma by characterizing the airflow obstruction, assess reversibility, and exclude other diagnoses. Next, we're going to move on to policy development. To address the issue of adolescent asthma, the National Asthma Control Program was developed. The major goal of this resource is to lessen complications by reducing the number of deaths, hospitalizations, emergency room visits, school or work days missed, and activity limitations. Additionally, the National Asthma Control Program funds programs and organizations to help improve the surveillance of asthma, train health professionals, educate those affected by asthma, and explain asthma to the public. Another resource that has been implemented to address asthma in adolescents is the Clean Air Act. As you can see, this law protects the public health and reduces asthmatics' exposure to air pollutants by requiring the EPA to regulate and maintain quality standards on these 6 criteria pollutants: carbon monoxide, lead, nitrogen dioxide, ozone, sulfur oxides, and PM. Next up, we will talk about how New Jersey addresses asthma. New Jersey has addressed asthma in adolescents by implementing their asthma awareness and education program. This resource develops control plans that track the disease, implement interventions, and address occupational components. Additional agendas include a statewide clearinghouse for pediatric asthma programs and services and a statewide interdepartmental asthma plan. Another way the state has addressed the issue is through the Pediatric and Adult Coalition of New Jersey. This organization works toward improving the quality of life in adolescents, as well as educating on how to manage asthma. They even uphold a school award program that supports the New Jersey school efforts to be in compliance with the New Jersey laws for asthma management and good indoor quality. So as you can see, there's several programs that are working to help these kids overcome this horrible illness. Now we're going to move on to existing policies. Currently, there are several policies that exist to help resolve issues for adolescents with asthma in New Jersey. First, the Asthmatic School Children's Treatment and Health Management Act of 2004 allows self-administration of medication by students with asthma. Second, the Public Employees Occupational Safety and Health Act addresses both health and safety hazards in schools, such as preventative measures, ventilation, microbe contamination, and remodeling and renovation issues. Thirdly, the Americans with Disabilities Act requires schools to eliminate and or minimize environmental triggers for those with asthma. Finally, the Family Education Rights Privacy Act protects the students' health rights. So we see here there's been a lot going on to help these kids with their asthma and laws to protect them from further implications. Now let's look at some policy development strategies. Although there are many great policies that we just discussed already, a couple new policies that could be developed for asthmatic adolescents in New Jersey are a mandatory asthma education course for staff and a mandatory food allergy training program for the food preparation staff in the cafeteria. The education course would help school staff recognize signs and symptoms, resolve emergency issues, and help teach students to self-monitor. The food allergy training course would help the cafeteria staff better identify common food allergies and those with asthma, plan for the prevention of contamination, and develop an emergency plan. It seems like a good idea to really start in the schools because the kids spend a lot of their time in the school and this is their learning environment. Oftentimes they go home and they're not really doing any learning. They're playing video games or whatever they're doing. So we need to really enforce this in the schools and get these kids on track. So next we're going to talk about stakeholders and potential facilitators. To assist with the policy development, several stakeholders and potential facilitators have been identified. School officials would be needed to enforce the policies and ensure compliance. Medical and food and allergy specialists will be needed to educate school staff. The Health Department and Pediatric Adult Asthma Coalition in New Jersey will both be needed to help implement and regulate education policies. All right. So, how the essential services of policy development are applied to asthma in adolescents is the next topic. So these essential services of policy development are applied to asthma in adolescents by first, informing of current issues, educating with facts, and empowering programs and organizations to help. Second, community partnerships are mobilized by bringing adolescents, their families, doctors, organizations, and programs all together as one to reduce disparities in adolescents asthmatics. Finally, developing policy is applied to adolescents with asthma by identifying the need and offering solutions to problems. All right, let's move on to this next section, assurance. This first slide here in assurance covers enforce. Laws and regulations are enforced by first identifying and creating strategies for addressing asthma in schools. Then by obligating schools to review strategies and adopt policies. And finally by requiring proof of that policy. Now let's take a look at link. Adolescents with asthma can be linked to needed personal health services by first identifying those with barriers to care, targeting health information to these individuals, and providing transportation to care facilities when needed. Once the youths have been linked to health services, the provision of health can be assured through asthma treatment plans, when otherwise would be unavailable. This plan would improve quality of life, help maintain proper treatment actions, reduce symptoms, and prevent hospital admissions. Next, we'll go on to assure. A competent public and personal health care workforce can be assured by assessing workforce, maintaining workforce standards, and continuing education and lifelong learning. Constantly assessing the workforce will allow for problems to be uncovered and resolved. Maintaining workforce standards can be done by enforcing and regularly inspecting for proper licenses and certifications. Continuing education and lifelong learning adds knowledge and proficiency to the healthcare workforce. Alright, now evaluate. When using the evaluation factor of assurance, it is necessary to determine whether or not the care for adolescents with asthma in New Jersey is effective, accessible, and of good quality. The answer to this is yes, because of the statewide strategic plan in effect, the decreasing of hospital rates for adolescents, the implementation of the Asthma Awareness and Education Program, the accomplishments of the Pediatric and Adult Asthma Coalition in New Jersey, and all the laws and regulations that are enforced throughout the state and nation. Now we'll look at research. Why is research important? When linking research to the assurance process, it is a good idea to identify and monitor new solutions and innovative research to be sure all angles are being looked at when it comes to reducing the prevalence of asthma in adolescents. Epidemiological studies gather important data and statistics needed for research practices. Linking research to health practices helps to provide the best care possible. Finally, the monitoring of public health system ensures quality of care is being upheld. Alright guys, let's just recap everything we just talked about real quick. First, I went over the assessment of adolescents in New Jersey with asthma. It was found that more than 35,000 suffer. It is more prevalent in boys and more common among blacks. The risk factor and essential services were also covered. Then I moved on to policy development. First, how adolescents' asthma was addressed through the nation and state was revealed, along with ideas for policy development, stakeholders, and essential services. The third section covered assurance. This showed the importance of enforcing laws and regulations, linking adolescents to personal health services, assuring a competent public and personal health care workforce, evaluating for effectiveness, accessibility, and quality, and then finally research. So this next couple slides is the references that were used to make this presentation. So that's about it. This concludes the presentation on the prevalence of asthma in adolescents of New Jersey. I want to thank you all for taking time out today to listen and learn. Do you all have any questions?